So now for the pharmacologic prevention and treatment of VTEs, our anticoagulation agents. So UFH, also called unfractionated heparin, the prophylaxis dosing is going to be 5,000 units sub-Q every 8 to 12 hours, with the treatment being 80 units per kilogram IV bolus, followed by 18 units per kilogram per hour IV infusion. Contraindications include uncontrolled active bleeding, severe thrombocytopenia, hypersensitivity to pork, and a history of HIT, which stands for heparin-induced thrombocytopenia. Adverse effects include HIT, hyperkalemia, bleeding, and thrombocytopenia. You're going to monitor UFH with an APTT or anti-factor 10A test. Also monitor the platelets, hemoglobin, and hematocrit levels. Now for our low molecular weight heparins. Our first one's going to be enoxaparin, brand name is Lovenox. Prophylaxis dosing is 30 milligrams sub-Q every 12 hours or 40 milligrams daily. If the creatine clearance is below 30, you're only doing 30 milligrams sub-Q daily. For treatment, you're going to do 1 milligram per kilogram sub-Q every 12 hours or just 1.5 milligrams per kilogram daily. Again, if the creatine clearance is below 30, you're going to do 1 milligram per kilogram sub-Q daily. Contraindications include a history of HIT, active major bleed, or hypersensitivity to pork. Side effects include bleeding, anemia, thrombocytopenia, hyperkalemia, and increased LFTs. And you're going to use an anti-factor 10A test to monitor this drug and also monitor the platelets, hemoglobin, hematocrit, and serum creatinine levels. Our next one is dalteparin, brand name Fragmin. Prophylaxis dosing is 2,500 units to 5,000 units sub-Q daily, with the treatment being 200 units per kilogram sub-Q daily or 100 units per kilogram twice daily. And just note the treatment is off-label when using it for VTE. Contraindications include a history of HIT, active major bleed, and hypersensitivity to pork. Side effects include bleeding, anemia, thrombocytopenia, hyperkalemia, and increased LFTs. You're going to want to monitor this using an anti-factor 10A test and also monitor the hemoglobin, serum creatine, platelets, and hematocrit levels.